If you're a med student, you need to master lower limb anatomy. Let's break it down step by step. First up, the blood supply. The main artery here is the femoral artery, which travels down the thigh and branches into the popliteal artery behind the knee. From there, it splits into the anterior and posterior tibial arteries, supplying blood to the lower leg and foot. Now, let's talk veins. The great saphenous vein runs from your ankle to your groin, while the small saphenous vein moves up the back of the leg. Both feed into the deep veins, ensuring efficient blood return to the heart. Finally, the nerves. The sciatic nerve is the superstar here, running from the lower back down to the foot. It splits into the tibial and common peroneal nerves around the knee, controlling muscle movement and sensation. That's a quick tour of the lower limb's blood supply and nerves. Keep studying and you'll master this in no time. Now that we've covered the blood supply and nerves, let's move on to the bones of the lower limb and their joints. The lower limb is composed of several key bones, starting with the femur, the longest and strongest bone in the body. It connects to the pelvis at the hip joint, forming a ball and socket joint for a wide range of motion. Moving down, we encounter the patella, or kneecap, which protects the knee joint. The knee joint is a hinge joint formed by the femur, tibia, and patella, allowing for flexion and extension. Below the knee, we have the tibia and fibula, the two bones of the lower leg. The tibia, or shin bone, is the larger and more medial bone, bearing most of the body's weight. The fibula runs parallel to the tibia and provides additional stability. At the distal end, we find the ankle joint, or talocrural joint, connecting the lower leg to the foot. This hinge joint enables dorsiflexion and plantar flexion movements. Finally, the foot comprises numerous bones, including the tarsals, metatarsals, and phalanges. The tarsal bones form the rear part of the foot, including the calcaneus, or heel bone, and the talus. The metatarsals form the middle part of the foot, while the phalanges are the bones of the toes. Understanding these bones and joints is crucial for comprehending movement and weight bearing. Keep these structures in mind as you continue your studies for a strong foundation in lower limb anatomy. Now that we have a solid understanding of the bones and joints of the lower limb, let's dive into the muscles that enable movement and provide stability. The muscles of the lower limb can be categorized into several groups based on their location and function. Starting with the hip, we have the gluteal muscles, which include the gluteus maximus, gluteus medius, and gluteus minimus. These muscles are crucial for movements such as hip extension, abduction, and medial rotation. The gluteus maximus is the largest and most superficial of these muscles, playing a key role in maintaining an upright posture. Moving down to the thigh, we encounter the quadriceps femoris group on the anterior side, consisting of four muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. These muscles extend the knee and are vital for activities like walking, running, and jumping. On the posterior side of the thigh, we have the hamstring muscles, which include the biceps femoris, semitendinosus, and semimembranosus. These muscles are responsible for knee flexion and hip extension. In the lower leg, the calf muscles dominate. The gastrocnemius and soleus muscles form the bulk of the calf and are essential for plantar flexion of the foot, such as when standing on tiptoes. The anterior compartment of the lower leg contains the tibialis anterior muscle, which is involved in dorsiflexion and inversion of the foot, playing a crucial role in stabilizing the ankle during walking. Finally, the muscles of the foot, including the intrinsic muscles, help with fine motor movements and provide support for the arches of the foot. These muscles ensure balance and adaptability on various surfaces. Understanding the muscles of the lower limb and their functions is key to appreciating how our bodies move and stay balanced. These muscles work in harmony to allow us to perform a wide range of activities, from simple walking to complex athletic maneuvers. Keep these muscle groups in mind as you continue to explore the fascinating world of lower limb anatomy.